cancer, also called malignancy, as an abnormal growth of cells. There are more than 100 types of cancer, including breast cancer, skin cancer, lung cancer, colon cancer, prostate cancer, and lymphoma. More than 10 million people around the world die each year from cancer. Experts project cancer deaths to rise to 13 million by 2030 if we do not act now. World Cancer Day aims to save millions of preventable deaths each year by raising awareness and educating about it. At Medicircle, we are conducting an exclusive interview series on the occasion of World Cancer Day, showcasing eminent oncologists over a discussion to bring awareness about cancer, its treatments, and myths related to it. Hi, this is Sana Khan, and today in this initiative, we are going to speak to Dr. Geetu Bhandoria. He is an associate professor of obstetrics and gyne-oncology at Command Hospital in Kolkata and has an experience of 19 years in the field of medical profession. He is an administrative fellow and member of Junior Editorial Board at International Journal of Gynecological Cancer, that is IJGC. Hello, Dr. Geetu. Welcome to Medicircle.
Thank you for the invitation, and I'm glad to speak, share my thoughts on World Cancer Day.
Pleasure is all ours. Okay, Dr. Geetu, what are the most common misconceptions or myths related to cancer?
Yeah, so the first and probably the most impactful miscommunication is that cancer, the moment you utter the word cancer, it's like signing a death warrant for the patient.
Right.
However, in current medical practice and with the current treatment options that we have, most of the patients actually live for quite a long time. And yes, death does occur, and death occurs eventually to all of us. But then almost 60 to 70% of cancer patients today live up to 5 years or beyond. So cancer does not mean death. Yes, there is a sort of conditions applied to this is if we are able to diagnose it at a relatively early stage. So that is an important prerequisite. The second notion is that it's increasing, the incidence seems to be increasing, and almost everybody around us is getting cancer. So I kind of disagree that the incidence is increasing. It is just that it is probably being more diagnosed now.
Right.
The overall diagnostic facilities have improved drastically over several decades now. And that is why probably this is a common notion that more cancer is happening now.
Okay. Does cancer have symptoms, or is it asymptomatic?
Yes. So again, that's a relative statement, as in some cancers can be symptomatic, whereas other cancers can be symptomatic.
Okay.
So I practice in the field of gynecological cancers.
Okay.
So among all gynecological cancer, the most lethal, or the one that kills most, despite the best treatment facilities, is the ovarian cancer.
Okay.
Which unfortunately stays relatively asymptomatic, or it does not have very specific symptoms in early stages.
Right.
The stages when it's almost curable, or you can control it for a long time, the first two stages. So it has symptoms, but they are relatively non-specific, and people keep ignoring it for some time, and by the time we are able to pick it up, it's usually reached third stage. And that is the basic reason that globally, it's not that it's only in our country, even in the developed nations, ovarian cancer continues to kill maximum women in gynecological cancers. Whereas other gynecological cancers like uterine cancer or cervical cancer, which are also very common. In fact, unfortunately, our country leads in the numbers of cervical cancer globally. So that relatively presents early and has very specific symptoms like abnormal vaginal discharge or abnormal bleeding. The statement that it doesn't have any specific symptoms or it is asymptomatic is kind of relatively wrong. They do have, most of the cancers have symptoms, and only thing is that probably we need to strengthen our awareness campaigns and make more and more people aware about these possible early warning symptoms, so that they report early, and maybe we can diagnose these patients at early stage when it is practically curable.
Right. Okay, Dr. Geetu, with the passing years, there has been an increase in the number of cancer. Um, According to a study in India, with a population of 1.35 billion, witnessed as many as 1.16 million new cancer cases and 7,84,800 cancer deaths in 2018. What are the reasons and how can it be controlled?
Okay, again, a very broad question. So as I mentioned earlier, that it's difficult to say for sure that cancer incidence is increasing, because we do not have very good statistics to support this statement.
Right.
Uh, but yes, overall longevity of human life is increasing. Overall diagnostic facilities, overall medical facilities, healthcare facilities around us are increasing. We have good diagnostic facilities now, even in smaller towns. Availability of ultrasounds and CT scans and good pathology labs.
Right.
So possibly that is why, and probably an easier access from rural areas to the bigger healthcare setups. So maybe
Right.
that is why more patients are being diagnosed now, and that is why these numbers show as if overall the cancer incidence could be increasing.
Mm-hmm.
So it could be a cumulative effect of both the things, that we have better diagnostic facilities
Okay.
everywhere, and also more people are now in the elderly age group, and which conventionally is kind of increased risk group for most of the cancers. So
Mm-hmm.
these two factors could probably lead to this interpretation or impression that cancer around us is increasing.
True. Thank you so much, Dr. Geetu, for coming to our show and sharing your valuable time and insights with us. It has been a pleasure having you on the show.
My honor. Thank you. Thank you for the invitation.
Thank you.